Hi, everyone. Dr. Liz here. Welcome to the Hypnotize Me podcast. I'm glad you're here, glad you're listening and learning, and hopefully it will help you with your journey along the way. I am a psychotherapist with a specialty in anxiety, insomnia, and deeper emotional healing. Hypnosis is one of the tools in my toolbox that I use to help people feel better and to help people be better. I do work all over the world. Please feel free to reach out and contact me if you would like some help. I've been an entrepreneur for most of my adult life, built an award-winning company, sold it, and then focused mainly on my private practice. That gives you a unique perspective, especially my ability to work with people in business at all kinds of levels. Before I go, if you'd like to support the podcast, you can go and subscribe to the newsletter. And you'll get free hypnosis downloads that you can listen to immediately. Another way is to buy one of the downloads that I have for sale. I only have a couple up there, but they're good ones. They've stood the test of time. I made the decision to not run ads during my podcast because I really do see it as an act of service. I completely respect people who do have ads on their podcast, but it's just not my path. All right, everyone, enjoy the episode. And I hope to see you back here soon. Hi everyone, Dr. Liz here. I met Katie in person after I had moved to Jacksonville, which is in North Florida. I was looking around for other people doing hypnosis in the area just to connect with them and see what specialties they have. Often therapists and hypnotists and hypnotherapists will refer to each other if they have certain specialty areas. And I found Katie and we just hit it off. So I said, hey, why don't you come on the podcast? Because she does quite a bit of medical hypnosis, which I don't do as much of. Now, there is some kind of sound going on in the background of her audio. I never could figure out what it was, but I don't think it's so distracting that I was going to not air the interview. In fact, you may not even hear it, but I thought I would mention it for those people who are more sound sensitive. I thought she gave great information during the interview. And then we also talk about the GLP-1s and support around them and weight loss. That's right around 30 minutes or so in case you want to skip ahead. So I thought that was really interesting information for people to hear as well. So I went ahead and decided to air it. Let's jump into it. I hope you're healthy and safe. Peace. Hi, Katie. Welcome to the Hypnotize Me podcast.
Thank you. I'm so happy to be here. I appreciate it.
Yes, absolutely. So let's jump in with how you actually got involved with hypnosis.
Oh boy. So the short version of that is my first exposure to hypnosis was back in graduate school, and was getting my master's in exercise physiology. And I literally thought I had a learning disability. I failed my master's boards epically. I was just so nervous and so just paralyzed. And probably 6 years later, I was bumping up against the deadline when you have to get it done. And I saw a sports psychologist, and essentially we did hypnosis. And I put this on my website. I tell everybody I heard words coming out of my mouth I didn't even know I knew. I was impressed with myself. And so I passed epically, got my master's. And
awesome. Is it an oral exam?
Yes, it's just an oral.
Oh, it's oral.
Yes.
Oh, geez. Those are hard.
You get the opportunity to prepare your answers. You get a whiteboard, some paper and pencils, not even pens. And we presented to the dean of the program and the medical director for Loyola Medical School. So that's not intimidating. I had moved to Denver, Colorado at that time too. So I flew back a couple of times to take it and just couldn't do it. So it took me a while. And then I've always been interested in complementary medicine and different techniques and different treatments out there besides pharmaceuticals or invasive techniques. And so hypnosis just kind of fell into that. I started studying more along the spirituality path for a while, mediumship, intuitive diagnoses, just intuition in general, and met some amazing people who worked for NASA, people who have been developing this in the UK for years, and really just kind of fell into it. It was kind of divine intervention in my mind. Finally, just being absolutely 150% clear on my focus and my direction and my purpose.
Okay, so this is how many years
now that
post
tells me how old
passing
I
those
am.
boards?
I passed. Yes, I passed my boards in 1993.
They can't see you. So.
Yeah. Yeah.
Oh, wow. Long time ago. Okay.
I was. Yeah.
So then you were working as an
multiple roles
exercise
over 30
physiologist
years
after
in medical in some way, shape, or form. I started off working in surgery, and then at different places around the hospital where I did my my internships, and loved it. So I was doing cardiac and pulmonary rehab, inpatient and outpatient. Moved into doing medical fitness as a trainer, working only with people who had a diagnosis of something or post-surgery, pain management, that type of thing. Not hardcore, bodybuilding training, really helping them heal beyond physical therapy and just keep getting stronger. And so that medical and that creative side of it just flowed really well. Yeah.
When you started getting into hypnosis, like intuition and stuff, during those years that you were more in the medical field, would you have intuition about a patient, like what they needed or what caused this or something, maybe even spiritual going on with them?
Yes. I haven't really ever said that out loud because in those days you didn't really talk about it in medicine.
Yeah.
Yes, I could. I've always been intuitive and very empathic. I spent a lot of time just bedside with patients.
Yeah.
Just being there, holding space for them, depending on what was going on, and sometimes praying with them. Sometimes just, I didn't really let them know what I was noticing. At that point, I was also studying Carolyn Mace. I don't know if you're familiar with her, but she is a medical intuitive. She works with Dr. Bernie Siegel out of Harvard with a 98% success rate for intuitive diagnosis.
Really?
Yes.
Meaning like they can't really figure out what's going on, or she would call it beforehand and she'd always be right.
She would call it alongside while they were doing the medical diagnostics.
Okay.
And then she worked alongside them saying, hey, here's what I'm getting. Here's what I'm thinking and feeling. And then they would compare that to the medical diagnostics.
Oh, wow.
Or she could use it to enhance it. Because we know science is now finally catching up to this, that all conditions and diagnoses have an energetic component, right? Something to the effect of, I have shoulder pain. Why might that be? That might be because I'm feeling a lot of pressure and taking the world on my shoulders. That could be anxiety. That's just manifesting in a physical way.
Yeah.
So it, as you know, right, it still starts in our minds. Even with pain starts in our mind. It just becomes physically manifest wherever it shows up in the body.
Yes.
So we can use that by speaking with patients more about what their journey has been, what's going on with them emotionally, physically, spiritually, mentally, and use all of those different pieces to intuit what we believe is going on. Now, I do not diagnose. I don't treat. I don't diagnose. I do not make recommendations on a course of treatment, physical treatment. I work strictly on a referral basis with medical and mental health providers. So I am part of their care team.
Mm-hmm. And these days, they're not seeing you for PT. They're seeing
Correct.
you for hypnosis.
Say that again,
They're
please.
seeing you for hypnosis.
They are seeing me for hypnosis. That's correct. Primarily, the way I can describe it is I work a lot with people who have feelings of anxiousness, whatever is causing those feelings,
Mm-hmm.
chronic illness, chronic pain, and the effects of those diagnoses and
Mm-hmm.
treatments.
Okay.
Yes.
So chronic pain, you said chronic diagnoses?
Chronic illness.
Chronic illness.
Yes, like autoimmune disorders, IBS, irritable bowel syndrome is a big one, a lot with gut health.
Mm-hmm.
And, autoimmunity starts in our gut, right?
Yeah.
And we know our mind and our gut have such a connection. There's a lot that people can do to heal all of that or
Mm-hmm.
not minimize the symptoms.
Let me get clear. So you're saying there's a lot through hypnosis they can do to heal some of those symptoms.
Yes, if a good way I can describe it is if you're healing your mind,
Mm-hmm.
you can heal your body, right?
Got it. Yes. There's
Yeah,
interaction. Like I do the IBS protocol out of University of North Carolina,
yeah,
Chapel Hill Medical School, and it is actually the most effective treatment on the market, far more than any medication for
yes,
difficult to treat IBS.
yes,
And so there was a time where I was getting referrals from the IBS clinic in Stanford, the top doctor there. And
yep,
so they would come to me when it's like, okay, they've done everything and they need this extra step, let's say.
yes. Mm-hmm.
And that would really help them. I actually didn't have any cases that weren't helped by the treatment. It's not going to take away IBS, although there is a medical hypnosis practitioner who told me once, like off the record, I won't say her name because it was off the record, but she said, we're not supposed to say we can cure things. Like legally, we can do that. Somebody could sue you or something. But she's like, okay, if I do this and then all the symptoms of IBS go away and they don't return for 10 years, what would you call that? We just sort of laughed, right? I was like,
Right.
okay, got it. We live in a culture today where legally we cannot say some things, but we do have that direct experience of hypnosis truly, truly helping patients on a different level than they've gotten from the, let's say, medical community, meaning MDs.
Yes.
And some of the MDs are better than others. I shared with you when I met you that I have a daughter with IBS and some strange symptoms that the Mayo Clinic is trying to figure out in Jacksonville. And her GI doctor was fantastic. When we got a new GI doctor, and we thought we had an adequate GI doctor for many years. But finally I was like, this is bullshit. Like, this is the last time he's going to say this is anxiety. And so we got a new one who I literally cried at the end of the appointment because
Oh,
she explained everything and was so thorough and said, yes, of course, anxiety affects this. Like, absolutely. You've got
yes.
to get a handle on that. You've got to go to treatment, whether that's hypnosis or cognitive behavioral therapy or whatever therapist you want to see. And there's an interaction there. But she
Right.
didn't say, like, your anxiety is causing your IBS. So, that's that. Go away. That's how some doctors are.
Oh, and it's such a vicious cycle too.
Mhm.
And knowing what I know now and how much hypnosis has helped me personally with so many conditions,
Mhm.
because in my family, if you have one diagnosis, you probably have 10 for different
Okay.
reasons, mostly autoimmune issues. But having experienced it myself and witnessed it, and I do try my best to keep up on the research. Right now, I think I have a bibliography of about 850 citations,
Whoa.
research in some shape or form on the use of hypnosis in different applications,
Wow.
right? Including newborns, And I don't know
Really?
how you do it with newborns, but there's some research on that.
What are they doing with newborns?
It's more just calming them if they're highly anxious. They've used it in some cases with babies whose mom has been addicted to drugs. So they
Uh-huh.
come into the world addicted. They've been able to show some good results with that, just calming their nervous system down.
Really? Is that,
Mhm.
I'm trying to picture it because I volunteered at the NICU down at Joe DiMaggio Children's Hospital in Hollywood for
Mm.
over a year, holding babies.
Yes.
So I would be sometimes put in the unit with the babies that were drug addicted. They were born drug addicted and they were um, weaning off, right? And
Mhm.
they have this particular cry that's so sad. And, it just has a certain tone to it that's like, whoa, that's a drug addicted baby. So I'm picturing this, like, are the practitioners piping in the music or are they holding the baby and murmuring to them and trying to reassure them and giving hypnotic suggestions?
I think that's more of, yes, it's partially what they were doing.
Yeah,
Um, and that
which is what a good mom does. Yeah,
right. Well, if they're not drug
drug
addicted,
addicted. Yeah,
even in that case, they may still, that energy, right? The baby still
yes,
feels that energy at conception.
yes,
They feel that, they absorb all of that, right? What mom and dad and the environment outside the womb, what's happening.
yes,
So they can even come into the world feeling anxious, not recognizing it, of course,
yeah,
in an anxious, heightened neurologic state, and not know why,
yes,
right?
yeah,
Or mom doesn't necessarily know why. I don't know that we always ask about what that environment is like, and that's
right.
one of the reasons I don't personally practice it, but I believe that hypnobirthing is so beautiful
Uh-huh.
that moms can be in that nice, relaxed, calm state for pain management, for
Yes,
anxiety, for fears, for all of the things that I imagine makes the birth experience traumatic. And so,
yes,
how
yeah,
lovely that they can
can.
do that. And
Hmm.
yeah,
Yeah, I took hypnobirthing with my second. And I had a pretty traumatic birth
did you?
anyway, but it was not because of the hypnobirthing. Believe me. Like the hypnobirthing was actually amazing. It was before I
Yeah.
was trained in hypnosis, actually.
Oh, really?
Oh, yeah. And so my doula was actually the hypnobirthing teacher. She'd see me like pop out of the trance, the pain would go off the scale, and I'd be like, oh my God, I can't do this. And she's like, she's the most calming woman in the world. Okay. And she's like, yes, you can. Let's get back into trance. She said, let's just count down. And I take a breath. I go back into trance. And she'd be like, waves, waves, as contractions are called, waves in the birthing. And I'd go right back in, and the pain would go right back down to like a two.
Love it. Yes.
So yeah, it
It's
was no fault of my own or hers or anybody's actually that
yeah.
I wasn't able to give natural birth. But I remember the hypnobirthing experience so clearly. So,
Oh, that's beautiful.
oh yeah. Speaking of research, when they do research on pain control in the brain, they know that it looks identical to drugs, pain drugs in the brain.
The brain doesn't know any different. We're just perceiving it differently
Yes.
and or not allowing those pain pathways, the pain signals to get through.
Mm-hmm.
We can block those with directed suggestion, directed focus,
Yes.
guided focus. Because what's happening if your mind isn't focusing on the physical sensation, your mind doesn't know the difference, right?
Yeah.
Between the reality and the visualization. And
Yeah.
so how beautiful is that we can actually learn to turn down the volume. And I love teaching. I teach everyone self-hypnosis,
Uh-huh.
especially for pain, control room of the mind or other mechanisms like that, where you can learn how to control that pain.
Mm-hmm.
You know,
Yes.
we will train them how to, especially if they're new, uh, working with me, that, okay, we'll teach them how to turn up that pain just a little bit, not so much that it's terrifying, but that they can understand the power of their own mind.
Oh, yeah.
They
Right.
can control that. You can drop into that state
Yes.
anytime you wish and go there and
Hmm.
just reset, refocus. And, um, if you're not noticing it, it won't register.
Yes. Yeah.
Right.
The focus is somewhere else.
Yes.
Hmm.
There has been some really amazing research, like you mentioned, Stanford, of course, that's,
Hmm.
the Mac Daddy of research.
It is.
And it is beautiful what they're doing up there in Harvard and
Hmm.
Oxford and all over the world. They're doing great research. I was just at a conference this past weekend in Orlando, a medical and dental hypnosis conference. And there's a woman, and I cannot pronounce her last name. She's Swedish,
Hmm.
also a nurse. She was presenting on her work at one of the hospitals out there, that she works in wound care
Hmm.
and she works in anesthesia
Hmm.
alongside the anesthetist,
Okay.
uh, on pain management. And so they are doing wound care there, strictly using hypnosis.
And what are they starting to find?
Well, they're finding that the patients, I want to call them patients, not clients, um, again, same thing with guided meditation and refocused attention. They're able to do some very painful, what normally would be very painful wound care, like debriding wounds, and they have to clean them. She works with people who have severe burns also, can be very, very painful. And so she can help her patients moderate that pain and tamp it down during those procedures.
Oh my gosh. Wow. Wow. I don't know if you're familiar with Dabney Ewan. He passed away a couple of years
No.
ago. He
Mm-mm.
was a doctor out of New Orleans, and he would get calls to the ER for guys coming off the oil rigs with severe burns. And he would do hypnosis with them in those very first critical hours. And the
Yes.
research he published was the wounds would heal faster. They'd grow hair back where they shouldn't be able to. Like it was all around how do we, help these wounds heal faster, really, and the
Yeah.
patient obviously feel better and come out of pain. So it reminds me of that research on wound care. But you're saying it's also tolerating um, procedures.
Tolerating the procedures, as you know, if you've even had a burn on your hand or a finger or something, they're very painful.
Oh, yeah.
And the heightened state of anxiety thereby increases pain levels, right?
Yes.
There's that whole cycle. The more anxious you
Oh,
have, the fears of, possibly fears of needles, white coat syndrome, if you want to call
yeah.
it a syndrome. It's even the anticipatory fear, anticipatory pain.
Yeah.
And so we can catch that on the front end, kind of like when I work, and I'm sure you do too, with like just pre-surgery,
Oh, yeah.
just the anxiety that people feel sometimes or anxiousness pre-surgery, all the unanswered questions, the what ifs, and we do quite a bit with that as well. We actually do a mental rehearsal
Okay.
several times of that actual day of
Hmm.
what that whole thing looks like from start to finish. And we are imagining it needing potentially less anesthesia,
Yes.
quicker healing,
Yes.
calm, easy healing. Those suggestions that may sound fluffy, but your brain visualizes it as if it's reality again. And so
Hmm.
it's been pretty amazing. I may have told you this, but I'll share with your listeners fun story of the Mayo brothers, who are a couple of spine surgeons up in Rochester, Minnesota. And back in the 1880s, 1890s, around that time, they were using chloroform and ether for anesthesia, but they had a very hard time controlling it. And so patients wouldn't necessarily make it through the surgeries, or they had major complications. And so their nurse anesthetist started using hypnosis for anesthesia. And
Mm.
the world noticed that their outcomes were better, their survival rates had improved, fewer complications. Um, and that really helped to launch them as world renowned surgeons. They were
Wow.
getting such amazing outcomes. Um, so if it worked back then, thinking we can do some great work now. even
Absolutely,
so.
right. Like fundamentally, we are the same kind of human beings.
Yes. Or, if you have somebody who might be very sensitive to anesthesia,
Yes.
can't take opiates,
Uh-huh.
which there's still more. I know that they've really cracked down on prescribing opiates.
I
There
can't
still
take
are.
opiates at all.
Yeah.
They make me so sick.
Do they?
Oh
Yeah.
my gosh. Yeah.
They can be wicked. Uh, a friend of mine she just had a kidney transplant, right?
Mm-hmm.
And she was taking oxycodone
Mm-hmm.
and was starting to feel a little anxious that, oh, I don't know, it's been 6 months now. Maybe I don't need to be taking this anymore. And she had some concerns that she might be dependent.
Mm-hmm.
And her doctor said, oh, don't worry about it. Just keep taking them. We'll worry about that later.
What? Oxycodone's 10 days. 10 days to addiction is the research on it.
Yeah. She asked me to work with her on that, to help her with any symptoms that she may or may not have. Sometimes, we can fabricate symptoms as well.
But like
With
weaning off of it and
Yeah,
tolerating, I use the word tolerating, but it's not really tolerating. It's
right,
moving into a more relaxed state and not fearing any pain that may occur or reducing
right,
it naturally through hypnosis, through the suggestions.
correct. Her doctor is aware of it.
Uh-huh.
Please make sure that he knows that this is what we're doing.
Yeah.
And so we are kind of reversing the anticipation of
Hmm.
symptoms coming on and that fear of, oh no, what happens if I feel something? Well, okay. You have no way of knowing that you will feel something. If you feel something different, this is how we'll work through it. Work through it that way with very positive and powerful suggestions, affirmations, visualization. Uh,
Hmm.
and we work through the day of this is just how it will be. And you have the confidence that this will always be manageable if anything arises. So we don't get into that spiral of, oh wait, I felt something.
Assuming. Yeah.
Yes, assuming, correct. Yeah,
Right. Assuming that pain's going to be there. It may not.
correct. Not manufacturing something that may or may not really be there physically, correct?
Yes.
Right? She's not hallucinating it, and
Oh, yeah.
she's
No.
just hyper alert. So
Yeah,
we're
I
turning
think
down that vigilance.
absolutely. And I've worked with chronic pain patients before, and I've had some myself and autoimmune myself. And you do get into this hypervigilance of like, is that it? Is that it? Like, is that part of this? Is that part of that? Like all the questioning. And so to come out of that, actually, I think hypnosis is a wonderful use to even relax the body, relax the mind, because when we get into that state, we do get like we tense up, we get anxious or worried, we
Right,
have concerns, and
right.
yeah, it's hard to know sometimes.
Well, I love how you said that. I work quite a bit with people who have chronic inflammation, as do I.
Hmm.
Uh, for your listener's sake, I have psoriatic arthritis, and it's in my fingers.
Mm.
One of them is still kind of inflamed. And I'm so used to doing, just like you said, that progressive relaxation. I do a lot of meditation anyway.
Yeah.
Back in the day when it all started in 1989, I literally could not walk for 6 months. It was that bad. I
Wow.
was also misdiagnosed. And so I'm kind of like, if these are the symptoms I have now, it's not a thing. And I actually saw my rheumatologist this morning, and she was looking at my hands like, you have active inflammation going on. And I didn't notice it because
You
it just
don't
doesn't
feel it. You
hurt.
don't
I
notice
don't
it.
feel it. Mm.
Wow. Are you, so during meditation, are you giving yourself suggestions?
Oh, yes. I have a couple of scripts that I wrote for myself and then I recorded them.
Uh-huh.
So I rotate through those if I need to. Just in general, in meditation every day, I add in some suggestions in there about pain levels and how that feels, right?
Wonderful.
Mhm.
I have arthritis in both knees.
Yes.
I had some pain in my hip recently, and I was like, "Oh my God, is this arthritis?" It turned out to be bursitis, which is
Oh,
inflammation, really.
it's
I didn't even
itis.
know what bursitis was a week ago. Okay, I'll just say.
Oh, me.
I called
Yeah.
my friend, the Pilates teacher, but she knows so much about physiology.
Yeah.
Like, I
Well,
think that's bursitis, and she's like, you have to lay off the Peloton. I'm like, no, because the exercise for me really releases all kinds of endorphins
oh,
and it
yeah.
just makes me literally feel better.
Yeah.
And so to tell someone that the inflammation is high, you have to rest. It's like, oh my God,
Yeah.
it's all this weighing, right? We all weigh the decisions we make. We weigh, okay, let's bring the inflammation down some so that
Yep.
you're not in pain all the time. And how do you stay active at the same time?
Yeah.
It's hard.
It is. And then you get into, it's easy to get into that, that fear cycle of, oh, I can't exercise, it's going to hurt.
Yes.
Okay. And when we have that, the parts work, right? That negotiation in your own mind about, well, I know I need to do this. Yeah, okay, it's going to hurt. Well, is it really? Does it have to? Maybe it doesn't have to hurt.
I love it.
Knowing your levels, right? So I do
Right.
quite a bit with exercise motivation and
Hmm.
um, sometimes you know how we have the chatter in our mind, right? All those swirling thoughts.
Yes.
And that's one of the things that I do quite often is, okay, what's that voice? Whose voice are you hearing right now? Oh, it's my voice. Okay. Well, if that pain is talking to you, what is it saying to you? Oh, it's screaming at me or it's whispering or whatever it is at whatever level. Okay, well, who's your favorite cartoon character? Let's say, I don't know, Donald Duck. Why not?
Uh-huh.
Okay, well, what if that voice sounded like Donald Duck? Speak to yourself in Donald Duck's voice.
Uh-huh.
They usually will start laughing. Well, what's it saying now? Well, this is ridiculous. Or it just helps to temper down that pain chatter in our mind.
Yes. Yeah.
I do that quite a bit with food noise too.
Oh, yeah. Okay. For food, for people wanting to lose weight or
Mm-hmm.
okay.
Yep. Oftentimes, when people are wanting to lose weight, they're hearing that constant chatter of, oh, I'm hungry.
Yeah.
I'm hungry. Oh, what am I going to have for dinner tonight? It's still 9 a.m. What am I going to have for dinner tonight? Oh, I don't know. Just constantly thinking about food.
Yeah. Or
Um,
self-loathing.
yes, all that chatter that goes on. And then the self-loathing because why am I thinking about food for so much? Why am I obsessed about food? Is there something wrong with me?
Right.
No, it's just old chatter in your mind. And we can
Yeah.
quiet that chatter down, give it another voice so it doesn't have so much power.
Yes.
Mhm.
I went on a medication for high pressure in my eye. I was only on it for 10 days because you can't be on it long term. And brought the pressure right down, but it took away food chatter.
Ah,
Any listener of the podcast for a long time knows that I struggled with overeating throughout my life.
mhm.
And the food chatter just went silent.
Wow.
Yeah, yeah. And I said to my eye doctor, the ophthalmologist, when I went back, I was like, is this what it's like to be on a GLP-1? It was not a GLP-1. I was like, is this what it's like? And he just laughed. But it's like, maybe this is what they're talking about. The food chatter just went silent, completely away. And we were just sort of, laughing about it.
Wow.
I think hypnosis actually is a very good use for that because not everybody can be on the GLP-1s or
Yeah.
wants to because we don't really know the long-term side effects of them yet.
Right. Well, and I will share with you and your listeners that I did go on the tirzepatide
Uh-huh.
for a few months, and I
Uh-huh.
wasn't really having food chatter. However, when I was on it, it suppressed my whole appetite, completely knocked it out to the point where I was having negative food chatter about, oh, you don't want to eat that. That's going to be gross. Ugh. It was almost
Oh, wow.
nauseating thinking about food.
No, very interesting, Katie.
I remember thinking, oh, isn't that interesting? I say that a lot these days. And I
Uh-huh.
knew that that couldn't be good. you end up getting into starvation mode and your metabolism slows way down, and you can have that rebound effect happen very easily. So I did quite a bit of meditation around that, and self-hypnosis around that as well. That food is nutrition, food is energy, food is good for your body and making better choices. I did have to force myself to eat. So I had to do a lot of self-encouragement. What good that did come out of that was getting me more into that habit of making better food choices and watching the amounts in a healthy way. So I didn't stay on that very long. That's a lot of what we do now too, for people who might be on those medications and maybe don't want to quit drinking or don't want to quit the Doritos. Well, okay, you can have the Doritos. Well, let's balance that out somewhere else to make sure you're getting the right nutrition and the right amounts. And so we can do a lot in hypnosis with that about wise food choices.
Look, all the research and the doctors in the world are saying you still have to change the food patterns, even when you're on them.
Yes. Well, that's physically what your body needs.
I love hypnosis as a supplement to that. I think some people have seen or feared, some hypnotherapists have feared, like, oh, the hypnosis for weight loss is going to disappear now. And it's like, oh, one, no, it isn't. And two, it's a really good supplemental for someone who is on a GLP-1 and does want to change the food patterns and keep that as permanent habits.
Yes, permanent habits is the goal. I do work with several clients now that, the way I can describe it is, if you don't want to change those patterns, we can help with the motivation to get to a point of wanting to change them. Do you want to spend a little bit more money up front for permanent change so that you can be successful permanently? Or do you, want to keep spending the money on some very expensive medications without really understanding the long-term effects?
Yeah.
So I think that's also a misnomer that, I'll switch to the semaglutide for maintenance and just stay on that for the rest of my life.
Yeah.
Well, we really still don't know the long-term effects. They have some research on it that they know of.
Yeah, but we have what's the longest research on it? Is it even 10 years?
I don't believe so. No.
Yeah, I don't think so either.
No, they haven't done any longitudinal studies.
Right. So who knows if someone can be on it the rest of their life? Like, we don't even really know if the rest of your life is 30 or 40 years. We actually don't know that.
Right. Yeah. There might be some messages out there from some providers that say, no, well, we don't know any long-term risks, so there must not be any. It's perfectly safe and healthy, which is not true. They don't know.
There's no way. Yeah. To me, that would be an unethical statement, let's say. My oldest daughter had a heart defect and had to have an implant at 2.5. And the research on it was about 10 years old. That's why it tipped it off in my brain. And we agreed to it because it was the best option at the time, very non-invasive. If she hadn't had this, then she would have had to have open heart surgery, crack her chest and all that stuff, which you can imagine for 2.5-year-old could be quite traumatic.
Yeah, and I can imagine
scars, all kinds of more complications, all of this. But we are very clear that the research was only about 10 years old, and she would be part of the research moving forward, actually, of, what do these devices do in adults and adulthood and all this stuff. And they said, well, we haven't found yet any, major complications that are happening, but that doesn't mean that there won't be. So, it's the same kind of messaging here. I don't think that kind of messaging is going on with the GLP-1s, to be honest.
No, it's for sure not. And, what I find frightening in that is that, then they have all of these sub pharmacies or you can just order it online for $10. It's the same thing. And it's not regulated that way.
Yeah.
So I have a lot of concerns about that. I think they can be very helpful if someone chooses to be on those medications,
Mm-hmm.
it takes a mindset shift.
Yes.
There's a lot underneath that, right? And
Mm-hmm.
I'm not saying everybody is this way. If you have, I work quite a bit with some obesity medicine doctors. One of them told me flat out, she says, I don't even refer to counseling. Once I got up off the floor, she does not do, any mental health in her practice.
Huh.
So I working on that slowly with her.
Yeah.
That there's a lot underneath that. And even if, someone wants to lose 30, 40 pounds, maybe.
Yeah.
Sorry, I take that back. Release 30 or 40 pounds, not lose.
Yeah, we're using the word release, right?
Release it.
That's release
Yes.
it.
Just give it
Because we
back
don't
to
want
the
to find
universe.
it. We really don't want to find it later.
No, I don't want to go find it. That's right.
Yeah.
We'll just release
Mhm.
it, give it back to the universe. You can take it
Yes.
back, and I'm okay with that.
Yeah, for the listeners, we're sort of having a hypnosis joke here.
Right.
If you're not familiar with hypnosis, we're very specific about our language. So
Yes.
often we don't say weight loss because you're often looking for something you lost. We don't want to find those 50 pounds again.
Right.
So instead we say release. We're
Correct.
releasing that wherever it wants
Releasing
to
that.
go.
Right. You don't have, it's not pain. You have discomfort. What is your
Yes,
level of comfort or discomfort?
right,
Whichever one you
right.
choose.
Yeah.
Um,
I do use the word pain sometimes because sometimes discomfort to me feels inauthentic to
yes.
myself. It's like, oh no, that's pain.
Yeah.
So I want to just validate in someone else too. Like, I get it. That is not always discomfort, but we're moving towards feeling better, towards moving it into discomfort, towards moving
Yes.
it into relief, towards moving it into actually, I feel really good today.
That's always an interesting conversation with providers. Um, I know there's in the medical hypnosis community, there is a big push, big lobby about the words that we choose in the
Yes.
healthcare. And everywhere you go, what's your level of pain? It's right there in your face in the hospital room. And
Yes.
there may be pain with this procedure. Don't worry about it. We'll give you medications. And it's pain, 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 pain.
Yeah.
Okay. And they have to. I recognize that.
Yeah. That's their language.
It does kind of anchor in, oh, well, then I'm going to have pain.
Hmm.
So we anticipate that we will. So it's been very interesting listening to those conversations about how we change the language that we use in what we do as hypnotists.
Yes.
That can make a difference.
Yes, it can. Yeah, agreed.
Yeah.
So we are coming to the end of our time here. This has been a wonderful conversation. Is there anything else you want to let people know about the kind of medical hypnosis you do? And also where to find you if they like to work with you?
Yeah, thank you. My website is wellmindedhypnosis.com. They can reach me online. My email is Kati, Kati, at wellmindedhypnosis.com. Feel free, reach out to me, schedule a 30-minute consult. We can chat about it. Even if you just want more information about what it can do and how I work. I just also want people to know that it's so important, especially in certain states like here in Florida. We work on a referral basis in partnership with clients' providers. We want to be part of their care team. We're constantly updating providers on what's going on, whatever information that my client approves me to share.
Mhm.
Usually it's just, especially with discomfort levels,
Mhm.
that's something we can manage. That's something that we can measure. So anything measurable,
Mhm.
I do as much as I can about that, different perception scales, pain scales, um, quality of life impact scales,
Yeah.
things like that, that we really want to be able to help clients gain some freedom from chronic illness, chronic pain, treatments, the effects of all of those things on that medical journey.
Yes, wonderful. Yeah, and I would say you said before, preparing for surgery is a really important
Yeah.
component of what you're doing, like to improve outcomes afterwards.
Yeah.
Yeah.
before, during, and after. It impacts your physical healing, emotional healing,
Yes.
especially if it's a big traumatic surgery, or even if it's not, that level
Yeah.
of cortisol just stays so high in our brains, and that impacts healing.
It does. Yeah, agreed. Since I've been trained in hypnosis, I have not had a surgery without doing my own hypnosis for myself.
Yeah.
Pre, post, that I listen to it. You can't listen to it during, but you can use hypnotic techniques.
Yeah.
I have one that I sell for cataract surgery to prepare for that because you have to be semi-awake. Most people, there's some people due to certain conditions they'll put under completely, but most people have to be semi-awake. And so that can be a little freaky. What I found is that after I use a recording, I can also use hypnotic techniques during the surgery. Anyway, we will wrap up here. Thank you so much, Katie, for sharing that information. If you'd like to work with Katie, then you know how to reach her. You do online, correct?
I do virtual. Yes, I
Okay.
absolutely do. It's equally as effective online.
Mm-hmm.
And then I have two offices, one office in Nocatee, Florida, and one office in St. Augustine, Florida.
Okay. And that's in North Florida, for those of you who don't know. Thank you so much for being on the podcast and sharing your wisdom with us today.
Oh, it's my pleasure. This was a blast.
I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis. So if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace. This podcast is not mental health treatment, nor should it replace mental health treatment. If you need therapy or hypnotherapy, please seek treatment from a trained professional.